Now we're going to talk about pathology of the endocannabinoid system, and I went back to the slide here that's showing all the systems that have CB1 and CB2 receptors. Because as we look at that, we're going to see the pathology really follows these systems. So the way that it's going to go out of balance is on these receptors in these organs, in the central nervous system, and so we see all these ones here. So that's really leads into this. So this is the pathology. This is something that came up with actually Dr. Chen, which is somebody that's a friend of mine. He's the lead researcher at UCLA on cannabinoids. There's a division in UCLA on cannabis medicine. Also a big one at UCSD, actually one of the oldest ones here at UCSD. So this is what he came up with. So if it goes out of balance, if it's deregulated, we start to see all these problems. So we'll start just with the first one. We have the kidneys. So we're going to see neuropathy in the kidneys. Because as we saw before, we have CB1 and CB2 receptors in the kidneys. We can see pancreatitis in the pancreas. So inflammation of the pancreas could come if you have a dysregulation of the endocannabinoid system. The adipose tissue, like obesity, they found that type 2 diabetes is actually an excess of the endocannabinoid system. And now we're seeing in medicine that you can have endocannabinoid pathology. And it's becoming a branch of biomedicine, just like neurology. There'll be endocannabinoidology, for example. So that's already starting quite a bit these days. We have skeletal muscles can be affected through the insulin resistance through the pancreas. Tumors is a big one. So there's been very, very interesting studies around cancer and tumors with cannabinoids. I went to a lecture at Harvard Medical School about a year and a half ago on cannabis medicine. One of the lead researchers from Israel was there, and he was a pathologist. What he did is he took cancer cells, grew them in a petri dish. So he'd take prostate cancer, for example, and then he would apply a strain of cannabis. So he'd have 5 strains of cannabis. He'd put one into the petri dish, nothing would happen. He'd put a second strain, and maybe 30% of the cancer would dissolve, would go away. Put another strain, maybe 50, another one 100%. And what they saw was, wow, each strain of cannabis has a completely different effect. Now he's came up today with having 5 cannabinoids and, for example, 5 terpenes, which we'll talk a little bit later. Terpenes are the aromatic molecules in all plants. They're actually the base of all essential oils. So they're the really small molecules in essential oils. So what he found is he found 5 of them. Now he can address a lot of the different cancers by mixing them. One of the really interesting things too is in the whole pharmaceutical side, a single molecule of a cannabinoid does not work as good at all as a full plant extract. And so what's happening in pharmacology is they're realizing that multiple molecules have a better effect than one by itself. And this is actually where herbology comes in, right? Herbalists, because we're dealing always with massive molecules, right? If you think about it on the biochemical side. So it's really opening up biochemists, biomedicine, to understand what herbology is, really. They coined a term called the entourage effect. You might have heard this if you've read anything about cannabis, which is just the base of herbology. It's kind of funny, they coined a special term that's used in cannabis medicine, but it's just what we've done as herbalists for 3,000 years. We're always looking for many different things together to create balance. Again, immune system, a lot of autoimmune diseases like cancer, but we have things like rheumatoid arthritis, scleroderma, affected the immune system. There's, as I mentioned, it's heavy in the CB2 receptors, bones like osteoporosis, reproductive organs, endometriosis, the eye, the respiratory tract is affected by the endocannabinoid system in pathology, circulatory system. Right, so here we're on the myocardial infarction, the osteosclerosis, heart failure, stroke, shock, all these pathologies are affected. The skin, any sort of inflammation, so dermatitis. Central nervous system, so this is a really big one, right? We see a lot of research on, for example, epilepsy, Alzheimer's, multiple sclerosis. If you think about, again, the radio knob, turning it up and turning it down, these are all problems with the actual firing of our nerves. So here we can take a phytocannabinoid, and of course the endocannabinoid system is working on this, is turning up and turning down. So this is how we're going to use the plant to help these type of conditions. The liver, things like hepatitis, fibrosis, and then the gut. The inflammatory gut diseases is a huge one. Crohn's disease, IBS, any inflammatory gut condition we're thinking about phytocannabinoids. So as you guys might know, if you think about the skin wraps in through our mouth, through our whole intestines, and out through the anus, meaning that you can look at the intestine walls as the skin. Right, as we mentioned, there's a lot of CB1 and CB2 receptors in the skin. Well, also, believe it or not, of course, in all the intestines, right? So it's like a topical application by taking a cannabinoid, some sort of product, and we can align the intestines. There's a couple companies do ones where actually the capsules open in the gut and not in the stomach. Those are the ones you want to look at for any sort of intestinal inflammation. We don't want them to open in the intestines, not in the stomach, right? So this is also an interesting one. So the pathology goes on, right? We have all these systems, and again, in herbology, we can heighten each of these systems with other herbs. So we know it's touching there, but why not put other herbs around it to really synergize those directions?